Hey guys, it's Jeannette. I hope you guys are doing well. It is the last week of Surg 2. So let's catch you guys up. I had exam 4 and I passed the exam by just like 1 point. Let me tell you what I did. So during an exam, I can tell if I'm going to do really well or I'm going to do really bad. And it's basically based off of my level of concentration. If I get twos, let's say some questions, I'm like, oh, I don't know that one, I'm not too sure, and they're kind of consecutive, I kind of freak out and my brain just goes out the window. So that happened to me, and at the end of the test, at the end of like question 50, I realized I had a few questions that weren't bubbled in, and I didn't have much time left. So then I started getting even more flustered. I'm like, okay, I need to go back. Okay, what do I want to put down? So I had maybe 6 of those questions, and then there was even one that I didn't even realize that I missed, like actually didn't bubble anything in. So there was just a lot of high anxiety, and on some of those questions that I did answer and got wrong, I didn't go with my first instinct. So really trust your first instinct. If you have 4 and you can knock out 2 and then you have 2 left and then there's like something that you know is for sure and then there's something that's distracting you, I mean, pick from those 2, you know, go ahead and put it in your bubble sheet and then put a question mark and then go back to it, and then maybe something will happen during the test. We're like, oh yeah, no, it's definitely the other one, or no, I know that one's it for sure. I'm going to rewatch this video so before my final exam, so I know what not to do. So yeah, go with your first instinct. Make sure that you always bubble it in. Put a question mark next to the questions that you're going between the 2. And if you don't know any of the 4, I mean, make an educated guess and move on. Those are the ones that you just like, was I even in class for this, or was this even taught? Pick from the 4 and move on. Okay, so let's talk about, so now that my grade wasn't so good for exam 4, it still kept my average, I think, at 83 or something like that. I knew that for my program, we have a proctored ATI exam at the end of the semester, so we could get extra points added. I think it's up to 20 points or 10 points. I don't know, any points added towards my exam average grade, I'm definitely going to try to do. So this semester, I went and did all the practice ATI assessments and literally wrote down line by line each question in terms of what I learned. If it had to do with hypoglycemic symptoms, so the question must have read, okay, a patient is experiencing a hypoglycemic crisis. What do you do? So then I'll just put in hypoglycemic crisis, do a 15-15 rule, or if it's in a hospital setting, use dextrose. I mean, so stuff like that. So every single line, it was just a point of new knowledge or new reinforced knowledge where kind of I just read them as facts. I hope that makes sense. Actually, sorry, I should just read you some. Okay. So for example, this is from the Immune ATI practice assessment. One of my first points is bone marrow suppression. Avoid eating fresh fruit because of bacteria in the patients at an increased risk for developing an infection. A pap smear, you test for cervical cancer, not HPV. So if I thought it was HPV, I would go ahead and also include that in that line. So when I'm reviewing this, I have to remember, okay, a pap smear is not for HPV, which is what I once thought, but it's really for testing for cervical cancer. Let's see, what else? Okay, let's see. Okay, for example, there's kind of a scenario question. A patient's post-op after an ulnar fracture repair, and the patient's stating the pain level is at an 8. The fingers are numb. The fingers are pale. What do? You call the primary care physician, and then you report possible compartment syndrome. So I think it was like 6 of these sheets. So I did, and they're all front to back, and there were all 30 questions each. 1, 2, 3, 4, maybe 5 of them. 4 front to back, and then 1 just one-sided. So I took every single assessment in a span of maybe 3 or 4 days. And I really just sat there and read the question, tried to really understand what they were asking me. And these are timed, but you have like 8 hours to complete 30 seconds. So I really took that quality time with the ATI assessment. I read it, and then I looked through the 4 answers. I'm like, okay, what do I know? What do I know? And whenever I clicked and either I got it right, I still read the rationale. for it because it's just reinforcing why that's the correct answer. And if I choose the wrong answer, you know, I learn why that's not the right answer. So I made that, and I actually reviewed it twice after I did all the assessments. I read it, I think, the night before and then the morning of, just to try to just get my mind thinking about facts. You know, sometimes when you get into exam mode, you start forgetting, like, what's a regular level of this, you know? Anyways, okay. So enough of that. Anyway, so I got in and I scored high enough to earn, I think it's 10 extra points, and that really does help because I think it bumps my average back up to, I think, an 86 or an 85. So I'm just happy about that, and I really do think prepping for ATI is a little harder. So I'm hoping that from me doing all those questions, that my brain's just ready to like take on the final, which is like 100 questions, 2 hours, I don't know, and it just gets me kind of like ready and motivated to do well on my final. And I also think just the content is med-surg, so that doesn't hurt me to review that, right? Okay. So anyways, for those that are actually on like the borderline of like failing depending on your final, that is a good way to try to add some extra points. I know at this point, because it's during foundations and mental health, I kind of didn't take the ATI serious. It was either I was feeling too like, over the semester, I don't want to prep for this exam, whatever happens happens, let me click away. For the most part, I don't really handle computerized tests that well because I'm just like click, 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 just get me out of there. So for the most part, my grades really didn't need the extra ATI points during first and like middle summer semester. But this semester I felt like I could have done better, but I'm taking the grades as, you know, what I've earned. And if there was an opportunity for me to add some extra points, I was going to do what I could to do that. And I'm happy that the hard work paid off. So yeah, I'll let you know how my final is. My final is on Thursday, and it's Tuesday today. So I'll let you guys know. Okay, so, oh yeah, and I did get an A on my 12-page paper. So I'm excited about that. I'm just glad the paper is over. We did have to do an APA style, so there are some feedback that I got like from my teacher that I have to go ahead and review just for future reference, and if I have to write any more APA style papers, I'll know what to do. And let's talk about what has happened today. I got an email, and I think my program is changing what course I take next semester. Is it PD? Is it OB? Or is it med-surg 2? So I'm super excited to find out what's happening. We didn't expect it. I just thought I was going to go into PD, OB. But we shall see, and I'll keep you guys posted. Hope you guys are doing well. Good luck for everyone who's taking their final exams. You guys can do it. Really take that alone time. Sorry. So like really take that alone time to just do quality studying and reviewing old stuff. Make sure you review any of the content that were on your lowest grades. So if your first exam wasn't too well, review that content because they will have everything on your final. Also, this semester we got a blueprint, which actually helps. So it still feels like a lot of information. So either way, whether you have a blueprint or not, you're just gonna feel overwhelmed. Just take it as the numbers go down. So with my blueprint, it was like 3 pages. First half, I started doing flashcards. So whatever it talked about, I went into flashcards, just wrote it out, and I read the notes in the book. And then I got a little bored, and then I started on the other end and started just with like printer paper, just started writing everything I knew about each topic. And then I would go into the book, look into the tables that just define like the clinical manifestations of the certain disease, nursing management, any patient education. So I'm hoping that that will get me through. And that's it. Let me just shut up. Well, good luck. Don't forget to comment, like, and subscribe, and share the videos. And that's about it. Bye.